morning, guys. This is Dr. Samaliazad. Today we're going to cover some of the structures associated with the respiratory system as well as the larynx part. We're going to go over a couple of different models and explore those structures for your identification. Now, if you're looking at this structure, you can see that the lung tissue there are two sections, one on the right side and one on the left. Grossly, when you're looking at the lung, it has the upper section, which is a cone shape, known as the apex, and the bottom part, which is kind of a flattened, known as the base part of the lung. You can see the location of the diaphragm, which is sitting right underneath it, and you can see the lobes that are located on either side. The right lung is composed of three lobes. If you look here, this is a superior lobe, this one is middle lobe, and this one down here is the inferior lobe. The left side composed of two lobes only, the superior and also the inferior. Now, the boundary for this one are based on the location of the fissures. If you look at this line here, this is a line that separates the superior lobe from the inferior lobe, and this one is known as the right horizontal fissure. Then you come this another line here. This is known as the oblique fissure or right oblique fissure, which separate the inferior from the middle. On the right side, since we have only two lobes, we only have one oblique fissure, which is the left oblique fissure of the lung, which separates superior and inferior from one another. The other thing that is kind of prominent and visible here, presence of this little depression known as a cardiac notch. The location of this one is due to presence of the heart at that location and proximity. Now, the air, when it comes up through the lung, I'm going to just follow this one through this section for your better visualization. If I remove these structures, we can compare it together and go from there. So, as you can see, the air is going to be entering right from the oral cavity, find its way to the throat, and from your throat find its way to this upper section, which is known as your larynx. Your larynx is composed of several cartilaginous tissue. The most prominent one here, known as the thyroid cartilage, commonly people also call that one Adam's apple. Right below that one, there is another cartilage here known as a cricoid cartilage. Cricoid cartilage is kind of small in front, but looking on the back, you can see it's such a large cartilaginous tissue here. Upper here, I have my hyoid bone, and there's a membrane here that connects the thyroid cartilage to the hyoid bone, and this membrane is known as thyrohyoid membrane. Then there's also another ligament down here that connects the cricoid to the thyroid, and this one is known as a cricothyroid ligament. As you come down here, then you can see these rings. There are somewhere between 16 to 20 rings alongside of these trachea parts. Your trachea begins at the level of the C5, C6 cervical region and all the way to level of the T5 where the two separation happens. There's a small ligament also here that connects the cricoid to the first tracheal ring. This ligament is known as the cricotracheal ligament. Then you go on the back side, and looking at it from the back side, you can see other structures there. So this one was my cricoid cartilage. As you come on the cricoid cartilage, you can find another pair of cartilages here. Of course, this one is covered by the two muscles, and these two muscles are known as the transverse and oblique arytenoid muscles. Now, this one is known as the arytenoid cartilage. Arytenoid cartilage, as it comes on the superior, on the top of it, you can see this like a small little horn sitting on either side. These are known as a corniculate cartilage. And as you come down here a little bit higher, you will discover these two cartilages known as a cuneiform cartilages. And ultimately, everything comes right up here to epiglottis. Epiglottis is a cartilaginous tissue in the form of a large flap that pulls over right in this opening, which is going to be to your oral to your respiratory tract and covering it during the drinking and also eating food, so no food is going to be entering right to that part. This little muscle here is known as a posterior cricoarytenoid muscle that is sitting right alongside there. Coming to the front, you can see the parts of the right lobe of the thyroid gland, and of course this is a superior thyroid artery which is sitting there. This muscle is known as a cricothyroid muscle, and this muscle is known as a thyrohyoid muscle that is sitting in this section. Opening that part, so if I grab this one, number one, if you look right into this area, you can see there is an opening. There is a, right down the center, this is a golidus, which is an opening sitting right there, where alongside of it located your vocal cords. So I'm going to open this one for you to be able to better visualize it. Now, as you separate this thing, you can see the area. We were looking through the epiglottis right into this section, and you can see two folds are here. Okay, the two folds are located there. This, the one that is sitting right here, this is a vocal fold, or commonly we call it true vocal fold. The other one here, this is known as the vestibular fold, or commonly known as a false vocal cord right there. Here again you can see from the lateral side, you can see the thyroid cartilage, you can see the epiglottis, you can see the coracoid cartilage, and of course the corniculate cartilage sitting there. As you go down in this area, you can see all the rings getting in there. At the level of the T5 in the thoracic region, the trachea is going to be dividing into two branches. The area where the branching is happening is known as the carina, which produce the right and left main or primary bronchi. Then as it goes down, it produces several secondaries. If you remember, we just discussed that the right lobe composed of 3 lobes, and the left side was composed of 2 lobes. So looking at this, you can see that as soon as the main bronchi comes, divide to 1, 2, and 3 secondary lobes. But on the left is only divided to 1 and 2 secondary. Each secondary lobe can divide into the tertiary lobes, and each tertiary lobe can divide into the bronchioles part. Ultimately, each bronchioles is going to be dividing to a smaller section known as a terminal bronchioles, and terminal bronchioles are the one that at the end of them located your alveolus duct and alveolus sac, where the gas exchange is going to be happening. So those areas that are located there are actually the respiratory part of the bronchioles. But this one are only the tract we're transmitting the air right on that section. And the other thing that also you got to remember here, that if I look on that part, right on the back side in this section here, the C-rings does not complete back here. This area on the back side is open. And that opening on the back side, there is another muscle located here known as a trachealis muscle. And right behind it, you have the esophagus. If you look, you see the esophagus is a collapsible tube, because we don't need to have that one open. That only opens up during the swallowing of the food. But your trachea must be open at any given time so you can get the air in and out of your lungs. So, by looking at this structure, I hope that you found it to be helpful, and thank you for watching.